My name's Dr. Alexa Levy, and I'm an interventional radiologist in Houston, Texas. I had the pleasure of meeting Gigi Jaggers about a year ago, and she was referred to me for this terrible chronic abdominal pain that she's had for over 16 years.
16 years ago, that would be 2008. I remember very specifically, I was at a dance competition, ballroom and Latin dancing, and I remember very specifically saying, something is wrong in my body. Wasn't able to quite connect all the dots. I just knew like there was a shift in my body.
She described it as like a baseline of 3 to 4 achy pain in the right upper quadrant that would get up to a 7 to 8 out of 10 or a 9 out of 10, almost take her breath away. And it was so bad she'd have to lay down and she wouldn't be able to do anything else for the rest of the day.
I had what I would consider a brush with death, where my organs were just slowly
She had been on high-dose opioids, she'd undergone an exploratory laparotomy, she had biliary stents exchanged, and finally she presented to me to see if there's something else she could do. After looking at her exam and imaging, MRI and CT imaging, and as well as doing a physical exam on her, I started thinking about causes of right upper quadrant pain and came up with, for her, maybe she had biliary dyskinesia. And one of the ways to treat that would be a splenic plexus block.
I had a procedure back in 2010, and it was a splenic nerve block. At that time, I'm just going to say it did not work for my body or what I was going through at that time. I was grateful to try it. I didn't have success, but there's a lot of factors that could go into that.
Even though she had had one of those back in 2010, I'm not the one who did it, so I figured I would try it again and see if it worked. And luckily it did, and she got significant relief.
I am so grateful that I did it. Maybe I went in with a little bit of skepticism, not possibly just a tiny bit, only because it had not worked before. I got about 8 weeks, a good solid 2 months of feeling amazing.
Blocks tend to be temporary and last only up to 6 to 10 weeks, depending on the steroid that's used. So after about 8 weeks, unfortunately, her symptoms started coming back. And after that, I said, why don't we try a cryoablation? Cryoablation basically allows for a reboot of the nerves that were abnormally stimulated and kind of allows them to re-signal in your baseline way without the abnormal signaling that was causing them to cause you pain or these symptoms. She underwent a cryoablation, and after her procedure, for the first time in 16 years, she said her pain is basically completely gone, which is absolutely amazing. Amazing for her and amazing as a clinician to be able to help out people in that way.
I have not been in bed one day, not one afternoon, not one nap. I feel fantastic. What do you have to lose? Try it. Talk to your interventional radiologist. Find one. Talk to them. Ask them specifically what do they have that they're able to do.
So it's really important whenever you have any type of pain to always talk to your primary care doctor or whichever doctor you're seeing, orthopedic surgeon, vascular surgeon, and remember to consult your interventional radiologist. Interventional radiologists have a unique set of skills, being able to use CT ultrasound guidance as a ways to target things. And most of your interventional radiologists tend to be trained in nerve blocks. Not all are trained in cryoablation, or what I like to call cryoneurolysis, but you can definitely check out your SIR website to try to find somebody near you that might be able to assist you in your procedure. These procedures can really help you out with your long-term pain management and hopefully get your life back on track to where you're more mobile, able to do more things, and able to live a better quality life with less opioids.